Athletes will often describe it feeling like someone kicked them in the back of the like foot or heel. That's the feeling that people often describe. And then they'll kind of fall over and realize that they've torn their Achilles. So it's pretty traumatic. So once it happens, you can't really walk afterwards. You kind of hobble along because your ability to control the foot diminishes pretty quickly. So that's the essence of what the tendon is. And I think we use the word athletes very broadly, but for example, it's like basketball players, football players are susceptible to Achilles tears. It's probably not going to happen if you are like a skier, for example, because they're not doing the type of jumping demands that would stress it. Or like tennis players are often also susceptible to it because it's that repetitive jumping and running that will overstress it. Not so much for long distance runners. So it's because they might get like an Achilles tendonitis, which is more of like a repetitive stress injury, but usually they don't go through a high enough force to actually cause it to tear because they're not trying to sprint. They're not going from 0 to 100 within this matter of like seconds the way that like an athlete would. So they like the chances of them tearing an Achilles is really low. They might have joint pain, they might have some knee pain, IT band pain. They'll get Achilles issues, but not a tear. They'll just get like tendonitis where like it hurts and it prevents them from running, but it's not like something that requires surgical repair for. Most people will probably just get like an Achilles like tendonitis or tendinosis. So tendonitis is when it's more like inflamed and short term. Once it's been going around for a long time, we'll call that like a tendinosis, which is more chronic. And the parts of the tendon will honestly degenerate a little bit. It gets weaker over time. That's more common.